Aloha, my name is David Walter Schenk, and I was a patient at Kālele where they treated me very well.
Hi, I'm Loretta Schenk and David's wife. I first met Richard at the hospital when Dave was at the hospital trying to figure out what the next step was going to be. Once they decided to discharge Dave, Richard said he'd start coming over at least once a week to see how we were doing and adjusting. He told me about Kālele, about how we could get help. He'd come over and check up on Dave and teach me how to be with the therapies, teach me how to be a caregiver. At first, you don't realize what caregiving is. I thought caregiving, hey, I do it all the time. You're a wife, you're always cooking, you're always cleaning. It's completely different because at this point, you don't get a minute to yourself. You're up getting water, doing pills, and filling in for anything he wants. Oh, I'm hungry, can I have an apple? Oh, I'm this, can I get this? So you're up running around and stuff, and that's where Richard steps in and says, oh, but there's services that can do this to help you out. Yeah, Richard and I talked, like I said, he'd come over every week. It was like families here.
When Richard would come to visit, he didn't make it look like it's all work and no play. He was happy to see things were going. He was wondering if I felt comfortable.
Even after his job was done, he was still looking in the future. He's looked at different programs for us to get into now that he's gone. So we have care that's going to be coming in. If it wasn't for Richard, I don't think I would have been mentally prepared for everything. Richard, I really appreciate for everything that you've done for us.
Well, I'm glad that you were the one that took care of us. We knew we were in good hands.